Yo, what the hell is going on? Welcome back to this video about fibromuscular dysplasia. This is a very classic and high yield cause of secondary hypertension on step one, and it comes up a lot, even though I feel like once you kind of figure it out and you kind of figure out how to recognize it, it's an easy question to get right, but it definitely comes a lot, and that's why it's worth knowing. Okay, so fibromuscular dysplasia is a non-sclerotic vascular disease. It's also non-inflammatory and affects mainly medium-sized arteries. And so the top two lines here, it's important to distinct it from, obviously atherosclerosis and vasculitis. And so you just have to know these two primarily, and then you will get most of your questions right. So NBME likes to test this because it's a classic cause of secondary hypertension, especially in young patients. And I know it usually is young women, but to be honest, I've seen a question of that like had a young man in it. So but like I feel like 90% of the time I've seen it was like a young woman. But the core mechanism of FMD is abnormal growth of the arterial wall, which leads to alternating areas of narrowing and dilation, and this disrupts normal blood flow, and it causes reduction in perfusion to tissues downstream of the affected artery. And now I don't know how important this part is, but FMD does affect the media of the arterial wall like the most often, and the fibrous tissue proliferates within the vessel wall, which causes this irregular thickening and narrowing of the lumen. And that's something you just have to know, that it just causes like a narrowing of the lumen. And this string of beads is very important. It's like the hallmark feature of FMD, and it represents the alternating stenotic and dilated segments of the artery. And it's obviously seen in CT angiography and even MR angiography. So the most common affected arteries are the renal arteries, followed by the carotid and vertebral. But to be honest, you just have to know it affects the renal arteries like 9.9 out of 10 times. And when FMD affects the renal arteries, it causes the renal artery stenosis, and this is going to cause reduced renal perfusion pressure, which causes the juxtaglomerular apparatus, the JG apparatus, and it's going to trigger an increased renin release, right? And this increased renin, it's going to lead to the activation of the renal angiotensin aldosterone system, the RAS system, right? It's been such a long time since I said the full name. The angiotensin 2, it's going to cause vasoconstriction, and aldosterone is going to cause increased sodium and water retention. And all of these is going to trigger, or all of these is going to result in secondary hypertension. And unlike primary hypertension, this type of hypertension is going to be very difficult to control, and it's usually pretty severe. And some of the cerebrovascular symptoms that you're going to see in FMD is like headaches, pulsatile tinnitus, transient ischemic attacks, or even stroke, and they're a result from reduced blood flow or arterial dissection. And some of the classic clinical cues that you're going to see, like I mentioned, is you're going to have either young or middle-aged woman. Not always, but like most of the time you're going to have that excuse me, with hypertension, and like no like traditional cardiovascular risk factors such as like diabetes or smoking or like hyperlipidemia. And sometimes you can hear a bruit over the abdomen or neck. But I mean, I wouldn't really look for that. I would just like if you have a question with like a young woman or middle-aged woman or whatever, and they just have like this really bad hypertension with like, and they don't have any risk factors, you can kind of dial in that it's FMD that they're talking about. That's kind of why I think this is a pretty easy diagnosis to make. Um, but if they give you a CT, obviously, it's gonna show like the beaded appearance, like the string of beads that I was mentioning earlier, and that's like a a big giveaway, right? So, um, yeah. So yeah, and I just mentioned that, and then management. So I mean, obviously, you just want to control the blood pressure, right? And so you can also do percutaneous transluminal angioplasty, and you rarely do surgery. It's not that serious. Like if you control the blood pressure, right? So some of the things that NBME likes to use to confuse you with FMD is like other causes of renal artery stenosis, such as atherosclerosis. But you just gotta know that atherosclerosis, it's usually gonna affect older patients, and it involves the proximal renal artery. Whereas you also have vasculitis, but then you're gonna have like obviously like the inflammatory lab abnormalities, and like I mentioned in slide two, or the beginning slide, like FMD is non-atherosclerotic and non-inflammatory, and it's in like younger patients. Yeah, here's a sample question. Just take a moment to read it, and you can pause the video, of course, but the answer is going to be revealed in 5 seconds. 5, 4, 3, 2, 1. Boom. Okay. Yeah, so which of the following is the most likely underlying pathology affecting this patient's renal artery? A 39-year-old woman is evaluated for persistent headaches and newly diagnosed hypertension. Her blood pressure is 158/96 milligrams of mercury, despite adherence to lifestyle modifications. She has no history of diabetes, hyperlipidemia, or smoking. Oh. Physical examination reveals a bruit over the left upper abdomen. Laboratory studies show normal serum creatinine and normal inflammatory markers. Okay. CT angiography of the renal arteries demonstrates alternating segments of luminal narrowing and dilation involving the mid portion of the left renal artery. Okay. So, just we're just gonna look at the last objective finding. CT angiography of the renal arteries demonstrates alternating segments of luminal narrowing and dilation involving the mid portion of the left renal artery. So that's this. This is saying alternating segments of luminal narrowing and dilation is pretty much saying, it's like pretty much describing like the beaded appearance, right? And so, that's kind of a huge clue. And like I mentioned in previous videos, the last objective finding is, usually what you're looking for, especially like when you have questions like this. When you don't know anything about it, just look at the last objective finding and like just answer it based on that. I think is like the best plan, especially if you don't know what you're talking about, right? Also, and then if you just go from the like bottom up, you can also see like, okay, so normal creatinine and normal inflammatory markers. So that's kind of telling you it's not going to be vasculitis, right? And then she has no history of like any like risk factors of atherosclerosis, so it's not going to be that. It's not leading to that. There is pretty much telling you it's not going to be atherosclerosis, right? Yeah, she's a young to middle-aged woman, and her blood pressure is pretty high. Like like a high blood pressure is like, or like if you have hypertension, it's like 140 over like 80, right? Or sorry, like 140 over 90. But this person has even higher than that, so it kind of shows that it's pretty severe. Yeah. And that's why it's pretty much FMD. It like kind of all points you in that direction. But I feel like even if they just give you this last sentence about the CT angiography, you can probably get the answer. But that's just what I mean by saying like the last objective finding is the most important line in the question stem. But yeah, yeah, that's pretty much it to this video. I feel like it's pretty well, like, you should get this question right if they give it to you. It is a free one. Just be careful, like they might not give you FMD in the question in the answer stem. They might just like you might have to know that it's FMD, but then they might give you something else like relating to FMD, if that makes sense. But yeah, hope this video helped. Obviously comment if you have any questions, but thank you for watching. Deuces.